You're listening to Aging Uncensored.
Good morning and welcome to Aging Uncensored. I'm our host today, Chaley Lawson, and I have a really special guest with us, Andrew Parrish from Homewood Pharmacy. Andrew is, how long have I known you? Like 10 years? A long time.
A long time, because I've been at Homewood since 2018.
Okay.
So close to that whole time.
Yeah. All right. So Andrew and I have worked closely together for quite a while. I got to know Andrew during my time in the geriatrics clinic at UAB and with house calls. And Andrew just immediately was like one of those guys who goes the extra mile, who gets what we're trying to do out here. And I think like when you have, when you care about your patients and you have that kind of special relationship with what you do and find meaning, like when you find other people like that, you kind of just hold on to them. And that's who Andrew has been to me. Also, everybody at Homewood Pharmacy has been that. This is not sponsored, but Homewood Pharmacy is the bomb. They are the best. I use them personally. I've used them for years with patients. Like the thing about Homewood Pharmacy is that when I come to them with a problem or something wild that the pharmacy down the road, I couldn't even get them on the phone for, Homewood Pharmacy is like, yeah, we'll handle that. We can do it. No problem. And so I always say about my dad goes to a big box pharmacy down the road that everyone would know the name of. And I always just say we just need to keep them in our prayers because they seem to really struggle over there. I know, in a way that Homewood does not. So all that to say, I want to give Andrew some time to speak for himself as well and do a brief introduction. So Andrew, tell us about yourself and tell us why.
Yeah, absolutely. Chaley, thank you so much. And I just thank you for those kind words. And I want to say the same thing about Chaley, that she's been such a blessing to us at Homewood Pharmacy. And we know that if someone is under your care, they're getting great care.
No, thank you.
And we can communicate and collaborate in a way that's not always the norm. It's the direction we want to go in, and we think it's best for patients, but it doesn't always happen that way. So thank you for that. So for me, I actually came into pharmacy. I did my undergrad at Alabama, a Spanish major. And I had no idea what I wanted to do
I love that.
with my career. And so I actually took a class, and pharmacy was one of the things that might fit. And so I started exploring it further. I knew a lady at my church that was a pharmacist and got a job with her and really fell in love with it. And it's less so the drug side. Like I see drugs as tools, right? Yeah. It's cool. It's cool to think that we can take this little tablet or capsule and have a positive effect, right? But at the end of the day, it's about a patient. I think in an ideal world, no one would have to take medicine, but that's not the reality that we're in. And so helping to educate people and make sure they have the right medicine at the right time and really forming that relationship is really important to me. And that's kind of my driving force. I want people to be healthy and to do the things that they want to do. And oftentimes that's not taking medicine, that's not coming to the pharmacy. So anything that I can do to make that better and easier for them, that's what I'm about. So I'm excited to be here with you today.
That's awesome. Yeah, it's about the big picture, right? Like, I know as a provider and a prescriber, like when I'm looking at starting a medicine, stopping a medicine, titrating a medicine, whatever, like I'm looking at the big picture. Like I'm always, like prescribing, the act of prescribing medications is never just like, here's a problem, here's a pill, we're done.
Sure.
Like it's like, here's a problem. How can we fix it? Is a medication safe? Does it interact with there's a whole like process that occurs in my brain that I'm not even sure I could completely break down. And I think that sometimes what I see and when patients get to me and I'm looking at a medication list is that I don't think it's a fault of the provider that they're seeing. I think that there's time constraints and other tools that they don't have access to that I have been privy to and blessed to have. And it's challenging. You get to people and you see it all the time. You see their medication list and you're like, holy cow, what is happening? I had a guy a few weeks ago, 92 years old, and was dizzy and having problems with low blood pressure. He was on carvedilol, which is a blood pressure medication. He was on doxazosin and tamsulosin, which are typically can be used, doxazosin for blood pressure sometimes, but for prostate also. Was taking Benadryl at night, was taking another antihistamine, like all of these medications combined. And I'm not sure that any of the providers had really taken a close look. And so sometimes like that's frustrating, but I want it in a perfect world. I think all providers would have the capacity to be able to look at that and see the big picture.
Absolutely. Unfortunately, there's momentum with time. And so a patient may pick up a drug from a primary care provider or a cardiologist or different people.
Yes.
And that's why it's important that you're at one pharmacy filling your medications,
that's right?
Whether it's with us or someone else, you want someone doing that final check to make sure like, okay, this makes sense to do these things together. But unfortunately, there's a momentum over time just to add medication.
I know.
Right. And so trying to take that back. And it's also important, I think, for patients to be aware as much as possible what they're taking and why they're taking it. And that can help avoid some of these issues as well. Yeah,
I totally agree. I think that like being open-minded about your medication list, like throughout life. Okay. Yeah. So like, I see older adults all the time who have been on medications for 30, 40 years that may no longer be benefiting them. Right. They may be harming them actually. Right. And like, I just encourage people to be open-minded about having a conversation with your provider. Like, why am I on this? Is this still helping me? Is there an opportunity for dose reduction? Is there an opportunity to stop this medicine? Like, think about like, 30 years ago, I was 5 years old, so I'm not the same person.
Right. No.
There were things I could tolerate as a 5-year-old that I can't tolerate now. And so in 10 years, in 20 years, in 30 years, it will be that case for me. And I think I see that all the time. It makes it so hard for, and I know like people have providers that they trust. But I think what you can do as a patient is be open-minded, ask questions. And then maybe at your yearly annual, or even making an appointment just to review medications is okay too.
Absolutely.
Like take a deep dive with your provider face to face with all of your meds and say, is there anything here we can cut out?
Yeah, I think that's absolutely the key. And also the provider needs an accurate list of what you're taking.
Oh my gosh.
And so you may see an online advertisement and you're like, oh, this helps with that. I'm going to start taking this over the counter item. I'm going to start taking Tylenol, ibuprofen, whatever.
Yeah.
It's over the counter. And so in your brain, oh, it must be safe. Yeah. Right. I don't have to have a prescription for this. And while generally, yes, that's the case, we still want to make sure with your other medications that they're not interacting.
That's right.
And whatever disease state, maybe it's not a good choice for that item. And so when you're doing these reviews, really let it be comprehensive.
Yeah.
You want to make sure that sometimes we call it a brown bag session, but essentially put everything that you have in that bag and bring it to your physician, your nurse practitioner, and just have a conversation. Like you said, that's key. And also with people, I've seen it before. I mentioned this before, but like sometimes doses. Primary care provider has one dose of a medication and say a cardiologist has a different dose. And so being able to reconcile those things together and have one accurate list is important, because if we're going to go up on a medication because your blood pressure is too high or down, vice versa, we have to have an accurate starting point.
Yep.
And so having the good input is going to get good output in the end with your medication list.
That's right. I've always said and always taught students that I've had too, like anytime we're making adjustments to meds, and especially insulin kind of comes to mind. Yeah. So with insulin, you've got the dose that's prescribed. You've got the dose they're actually taking.
Yep.
You've got the dose that's on their med list. And you've got the dose that their specialist prescribed.
Yep.
So that's 4.
Yep.
And then you've got what they actually tell you that they do sometimes.
Sure.
So like you've got all these moving pieces that you've, as a provider, have got to put the pieces together and solve the puzzle and see where they're at. Like you cannot depend on a list itself, or like it has to be a conversation.
Absolutely. And we have opportunities to do this as well. Maybe not as often due to time constraints, but we do medication therapy management. And so patients can come into the pharmacy, same type situation, bring in all the medications they're taking. We'll do a review, we'll do education. And I ask people, show me how you're taking this, or tell me how you're taking this. I'm not going to trust. I've learned over time, just because it says take one tablet at this time doesn't mean that that's what actually happens. And so having that open-ended conversation, as opposed to say, you're taking this in the morning, right? Say, how are you taking this medication? And so we found that to be effective.
I love that. And I think that if you are at a pharmacy, like no matter where you're at, where that kind of service is not available to you, like you don't have that kind of relationship with your pharmacist, they don't have the time to do that, like you need to find a new one.
Absolutely. Absolutely. And it's, we say this a lot, but pharmacists are some of the most accessible healthcare professionals. For something like that, we would prefer to have an appointment to make sure you have the time, but you can pick up the phone at any time, and we're going to answer the phone, and we're going to answer it quickly, and we can start moving whatever direction we need to move in. It may be a conversation that we have, and then we talk with you about whatever's going on, and we can get the ball moving in the right direction. So don't hesitate to reach out to your pharmacist with any questions that you have. Like I said before, if you're starting a new med, ask about what it's for and what side effects to expect before doing anything over the counter. Check with us.
Yeah, I love that. I love the fact that you brought up over-the-counter meds aren't always safe. I think that there's this general belief that anything you can pull off the counter must not cause harm. And that's just not the case. I think common things like, in older adults, we think about antihistamines and the side effects that they've had, which we've talked about in this podcast before. And then I also think about NSAIDs. I worked in nephrology for a bit. So with people who have kidney disease, NSAIDs can be problematic. And sometimes people don't realize, like, we understand that, like, your average person doesn't necessarily know, but ask your pharmacist, like, they will know, they will be able to guide you. Please don't assume that because you're pulling something off the shelf is safe.
Yes, that's key. I'm glad you reiterated that point.
Kind of like the patient I had in clinic one time who came in with abdominal pain. And I was getting their history and figuring out what was going on. And they had, the night before, had drank 8 Senna teas. So, and they assumed that was safe because it was, they bought it at the grocery store, like Whole Foods or something. And it was tea. So, like, you can drink all the tea you want, right?
Not in this case.
Yeah. So, all that to say, like, just be cautious. Talk to your provider. Talk to your pharmacist.
Don't assume.
Don't assume.
No.
Ever. We know what happens when people assume.
We know what happens, so don't do that.
Don't do it.
That's right.
Another thing I see a lot, and I think this is where meeting with your pharmacist, like you recommended, can help this, is the prescribing cascade. And I remember in nursing school, or maybe it was nurse practitioner school, I can't remember, but like there was like this, and you've probably seen it before too. It was like an example of a prescribing cascade. It was like, start with one medicine, get a side effect, start another, get a side effect, start another, get a side effect. And before you know it, you're on 6 meds. And it was really just one problem, but that had and so we see it all the time. It's like, someone starts metformin, they get GI upset. Well, then they start them on, Lamodal. I don't know. And then they get constipated. Well, then they start them on something else. Well, but there were other things that could have been done. Like, could you reduce the dose of metformin? Could you make it extended release, which Andrew taught me. He's taught me a lot over the years. Like really paying attention, like not being quick to just add another pill, add another pill, add another pill.
Yeah, getting really to the root of the issue. And so I think that's important for prescribers to be well aware of, and the pharmacists too. But if we're having a side effect from the medication, don't immediately go to new therapy, right? Because then that's going to have, like, just like you talked about, it's going to have new side effects. And then we're just, at some point, we're just going to get gigantic med lists with drug interactions and things that you don't actually need.
Yep.
And so I think it's important that every medication you take, there's a reason behind it beyond just a side effect to another medication. And so really dialing in when you're talking to your doctor, when you're having your own list, like, I am taking this for my blood pressure. I am taking this for my heart. I am taking this for my kidneys, whatever the reason is, to know that, and for every medication to have a purpose.
Yeah.
And that's good practice.
Yeah.
And that's key.
It's also just expensive to start being on a lot of medicines.
Yeah.
Like,
oh man,
it's expensive.
Especially some of the new medications, brand name.
Yes.
And we're talking really high copays. That's a struggle in the pharmacy world, because you can have an ideal drug on paper.
Yeah.
It's going to treat exactly what needs to be treated. But if the patient can't pay for it, they're not actually taking it. It's doing them no good.
Yeah.
And so you have to look for alternatives. And that's a definite challenge.
For sure.
A reason why people don't take their medication, just because they can't afford it.
Yeah.
And so looking for programs to help with that, or looking for alternative medications, is really important. And sometimes physicians may think, oh, they've been taking this for a few weeks. But the reality is they haven't picked up their prescription.
Yeah.
And so that goes back to the communication between provider and pharmacist.
Yep.
So you can't just assume, I prescribed this medication 3 weeks ago.
That's right.
Therefore, they've been taking it consistently for 3 weeks. And so that's just something to think about as well. And be honest with your doctor.
Yep.
Like, don't try to hide.
No, please don't.
Don't try to hide. Be honest.
This is the no judgment zone. Like, please just be honest with us.
Yeah.
It is okay. We get it.
It's better to have correct information.
Yep.
Don't tell someone what you think they want to hear.
Right.
Right. Tell them the truth. Because if you think someone's been taking this medication consistently, but we're not seeing any effect from it, then you might increase the dose. You might switch it to a different medication. You get all sorts of problems just because they weren't honest to start with.
Yes, 100%. And I can think of a couple instances in the last few weeks where I prescribed medications that were really high cost and immediately gotten a message from Mason and been like, hey, FYI, do you want to do this instead? I'm like, oh, yes, absolutely. Thank you for. And a couple of them were things that were really important. Like, if the patient had not been on that therapy when I needed them to be, like, we would have been in trouble. They would have been hospitalized, or something would have happened. And so, like, having that open line of communication is so valuable.
Absolutely is.
So yeah. And like the cost issue, that could be a whole podcast. Actually, we could probably talk about that. The challenge that I see too, I see 5 million challenges, but one of them is that the path to access is so nuanced. It's hard to navigate it.
Yeah.
It's hard for providers. It's hard for pharmacists. It's impossible for patients. They just hear like, well, that's $400. Can't get it. Too bad.
Right.
You know? And so that's just really hard.
It is. And we try to do everything we can. So at times there are discount cards that you can get. But unfortunately, in the elderly population, a lot of times the discount cards, you're not even allowed to use them.
I know.
And so that's really frustrating. But, you know, we do what we can to help with that.
That's really hard.
Yeah, it is.
All right, switching gears here a little bit, because there's just so many things exciting to talk about in the pharmacy world. Let's talk about high risk medications a little bit. Like, I know there's a lot of them, but like, what are some high risk medications that when we see an older adult on, or we see even maybe they're 60, but they're frail, you know, like they're fragile, they're medically complex. Like, let's talk about maybe some high risk medications that if you're looking at a patient's profile, or you're filling prescriptions, like what kind of makes you go, eh?
Yeah, you mentioned some earlier. Benzodiazepines is a big one.
So that's your Xanax, Ativan,
Valium,
temazepam.
Yes.
And one thing about those is sometimes patients will say to me, well, I'm on Xanax, but I only take 0.25, and that's a small amount of a medicine. It's not, that's not how that works.
That's right. And as we age, as we all know, our bodies change.
Yep.
We mentioned that earlier.
Yep.
We generally lose muscle mass, and we gain weight, we gain fat. And so the medication is not going to work the same in your body as it is for a young person. So that low dose may be too high of a dose.
That's right.
For you. Just because it's the lowest dose doesn't mean it's the correct dose for you.
Yeah.
And so that's something to remember as well. Just as our body ages, the way we eliminate drugs or we get them out of our body, it changes.
That's
and
right.
oftentimes it hangs around longer.
It
So
does.
that's something we have to consider.
That's exactly right. And so just because you've been on 0.25 of Xanax for 30 years doesn't mean that it's serving you well at this point.
Right.
And like, you know, our job is to do no harm here, and we don't want to cause harm by a pill.
No, we don't. And I think sometimes there can be a mentality of someone's trying to take something away from me.
Sure.
Like this helps me. Someone's trying to take it away from
Yeah.
me. And so it's just part of that's having that relationship,
Yep.
you know, be like, hey, because I care about you, I believe this will be better for you. You'll have a better outcome if you're willing to come off of this. And so it comes from a place genuinely of love and not of like a punishment
That's
of some
right.
way. It's
That's
for
right.
for their good.
That's exactly right. And I think that's an excellent point. And I think it's sad that we have patients that feel that way. And I think that a lot of it goes back to like how chaotic our healthcare system is.
Sure.
And so sometimes patients feel like as they've navigated the system and it's been so hard that they have to show up with a little bit of a like
An edge.
like a wall.
And I think there's a balance there.
And that I think so too.
Because you don't want to come in as with kind of a hard edge, but at the same time, you do want to advocate for yourself.
Absolutely.
And so that's going back to what we were talking about earlier, is knowing what you're taking, why you're taking it, being honest. Like all those things are important.
Absolutely.
But coming in with a negative feeling to start is probably not going to go as well as it could.
I agree. And like finding a provider that's a good fit for you and that you feel like you can have those kind of conversations with, like it's okay to, you know, set up expectations with a provider and have a conversation with them about like what you're wanting and what you're wanting to get out of the relationship. Like, you know, that's an important communication piece. We could have a whole podcast on how to communicate with your provider.
So many topics.
We
could just sit here all day and
think
talk
of them
about
all the
these
time, like at 11:30 at night when I can't sleep because I had a Celsius at 2 p.m. and all of those things.
Yeah.
So I kind of interrupted you and went off on a tangent about low dose on Xanax.
Yeah.
But like, let's talk about some other medicines. Like, what are other things that make you go? Ooh.
Antihistamines, certain pain medications, medications that interact with the central nervous system, a bunch of them all together. You mentioned insulin earlier.
I know.
Sulfonylureas, which is a type of medication used for diabetes, just really high risk for low blood sugar.
Oh my
So
gosh.
just so many things.
I cannot tell you, Andrew, how many people, older adults, are walking around in Birmingham with blood sugars of 60. It is crazy to me.
You're not going to feel good.
No, they feel terrible.
Yeah.
They feel horrible, but they think that they think their blood sugar is well controlled.
Right.
So they're like, we're good here. I make adjustments to diabetes medications all the time.
Mm-hmm.
We could also have another episode on just diabetes medicines. But like, just like, also knowing that like a therapeutic range for your blood sugar or your blood pressure or any like metric, any number on a screen is going to look different as we age.
Absolutely.
Like the 92-year-old I talked about earlier had a blood pressure of 150 over 78.
Mm-hmm.
That's fine for a 92-year-old.
Yep.
That's within range.
Yep.
But someone got aggressive with his blood pressure management and started adding medicines. And so like knowing that like normal as you age is different.
Mm-hmm.
So,
It is.
and I always tell people all the time, like, I don't care about a number on a screen.
Right.
I feel about how you feel. I care about how you feel.
Absolutely. And that goes back to the whole, our why, right?
Yep.
That we care about the patient. We don't care about only the number. Again, the medications, the numbers are all tools that we use.
That's
they
right.
give us a snapshot,
Yep.
right? Like, okay, they're close to in range, but how are you feeling?
Right.
Right. And so it is a balance there. They're tools that we use, but they're not the end all be all.
That's right. Absolutely. Beautiful. Well, thank you so much for talking to me.
Well, this was great.
It was awesome.
It's wonderful to be with you and chat about these things.
Yeah.
And I hope something that we said, is helpful.
I hope so too.
If nothing else, like, be an advocate for yourself. Go have that conversation with your provider, with all of your meds. And I think it's worthwhile to do that.
That's perfect. And then we're going to do a part 2 and we'll talk about medication management a little bit.
Let's do it.
All right, cool. Oh, and don't forget to like, subscribe, share, tell your friends, tell your neighbors, tell everybody. And thanks. We'll see you next time.